The many conflicts in the world, including Gaza and Ukraine, serve as stark reminders of the fragile nature of accessing critical health services. This week, we will collectively decide on next steps on both the pandemic agreement and on the IHR amendment and negotiations.
I'll give you as many updates as I can. We're going to try and jam in as many interviews and as much coverage as we can in 2 days, and we'll be back in Canada to ring the alarm bells. Visit nopandemictreaty.com. Ezra Levant here. I just landed in Geneva, Switzerland. Behind me, the United Nations office here. We're actually surrounded by NGO-type offices. Up there, the International Red Cross. And of course, the most luxurious building around is this restaurant where all the ambassadors, politicians, lobbyists, and other hangers-on spend your money having a delicious 5-star lunch. The reason I'm here is not because Switzerland itself is interesting. Sometimes we travel places to see what's going on in Ireland, in France. But we're here in Geneva because this is where Canadian law is being written. Let me explain. I don't know if you know this, but the World Health Organization is part of the United Nations. That's where Dr. Tedros basically ordered the world to lock down.
The risk of returning to lockdown remains very real if countries do not manage the transition.
And Canada's Chief Public Health Officer, Theresa Tam, was part of the World Health Organization committees that threw the world into lockdown. Well, Theresa Tam is back. She is here, and she is here with people from around the world, none of them elected, to pass a pandemic treaty. You heard that right. The one we all went through with COVID-19 was a test drive. Some things they got wrong, they think. Some things they got right. They want to codify this in a treaty so that the next one, and they say there will be a next one, they can snap into attention with a global response that's drafted here at the UN, not back home in Ottawa.
I believe the time is right for an international treaty or other legally binding instrument to provide the framework for a more coherent and coordinated response to future epidemics and pandemics.
You may have seen headlines the other day that the countries of the world could not agree on the text of the treaty. And you may have thought, oh, good, we dodged a bullet. Who are you kidding? They're continuing to work on it right now. And just like the UN global warming, for instance, meets year after year, they will chip away at our national sovereignty and keep pushing their agenda year after year. They are not done. In fact, they would love to meet again in a year, everyone flying to Geneva, everyone dining at the 5-star restaurant. The number one point I want to say to you is if you thought Theresa Tam and Justin Trudeau were bad in COVID-19, imagine how much worse they'll be with a pandemic treaty behind them, with a law that is drafted here in Geneva, not in Canada's Parliament, not debated in Canada's Parliament, not with consultations for Canadian voters, but foreign interests, including large pharmaceutical interests who bankroll the World Health Organization. That's why we're here. I see people coming from other countries. I see ambassadors and staff from every country in the world. This is globalism at its worst. And if you think I'm kidding or exaggerating, let me share with you a clip from Theresa Tam herself. In fact, I want to play this entire 2-minute speech of hers because I want you to understand what her agenda is. Yes, it's to have a global law for lockdowns, but listen to her talk about DEI, diversity, equity, inclusion. Listen to her talk about 2SLQ, LGBT, whatever. Listen to her talk about Ukraine and Gaza. There is nothing that she doesn't see this pandemic treaty doing. Cooked up here, not at home. Take a look at Theresa Tam.
Together, we must improve health promotion efforts to reduce disease burden and foster mental and physical health and well-being. An integrated approach to essential service delivery requires the inclusion of nutrition, sexual and reproductive health and rights, and routine vaccination. This also means strengthening both external and domestic financing for health, which is why Canada is invested in the Lusaka agenda. We must also step up our efforts to address systemic and historical discrimination against Indigenous peoples within our health systems. Gender equality is foundational to a peaceful, prosperous, and sustainable future for all. Let us continue to fight racism, sexual and gender-based violence, and discrimination against marginalized groups, including 2S LGBTQI+ people, women, and girls. And let us renew our support for those on the front lines of care. We have a collective responsibility to ensure the protection of our healthcare workers and condemn the unacceptable attack on them and on health facilities. The many conflicts in the world, including Gaza and Ukraine, serve as stark reminders of the fragile nature of accessing critical health services. Canada urges all member states to support WHO's critical health emergencies work. A strong WHO must also be inclusive, reflecting the entire global community. This means supporting Taiwan's meaningful participation as an observer at the World Health Assembly. This week, we will collectively decide on next steps on both the pandemic agreement and on the IHR amendment and negotiations. Canada remains committed to continuing to work together to prevent and minimize the devastating consequences of future global health emergencies and pandemics, and to further advancing health equity for all. A meaningful pandemic agreement is consensus-based and one that member states can sign, ratify, and implement. Thank you very much.
I'm here in Geneva today and tomorrow. I just got off the plane. I haven't even had a chance to check in at our hotel yet and have a shower. I'm a little disheveled. Forgive me for that. We flew here, and we are not just going to report on the treaty, which is difficult because, of course, we're not allowed access to where the delegates are. But we understand that there is a global coalition fighting back, including some Canadian doctors and some other famous dissidents that you would know their names from COVID-19, for example, Dr. Malone. So we are going to meet with the resistance. In fact, tonight we're going to head just across the border in France, where they're trying to get together a trucker-style convoy to converge here in Geneva. Now, I don't know what's going to happen. I don't know if it's going to be a big turnout or just a few people. I don't know if people have stopped caring because the crisis has passed. I think that's what they're counting on here. These folks at the UN behind me are counting on everyone going back to life as normal, forgetting the crisis while they beaver away to make plans for the next crisis when their reaction will be 10 times tougher. I want to keep you posted on this. We've set up a special website, nopandemicctreaty.com, nopandemicctreaty.com. That's where we're going to compile our videos on this subject and invite you to sign our petition against the pandemic treaty. I don't believe in a pandemic treaty, but I especially don't believe in one that is written in a foreign country without our democratic assent. Finally, I did fly here overnight along with our head of video, Efrain Flores Monsanto. And if you can help the two of us cover our economy class airfare and hotel, I'd be grateful to you. Geneva is a pretty far journey. There's no direct flights from Canada, so we had to sort of hop, skip, and jump our way here. We're staying economy class, but between the two of us, the flights and the hotel will add up to more than $2,500. If you can help me cover the cost of that at nopandemicctreaty.com, I'd be grateful. I'll give you as many updates as I can. We're going to try and jam in as many interviews and as much coverage as we can in 2 days, and we'll be back in Canada to ring the alarm bells. Visit nopandemicctreaty.com.